Hi there. My references are Psychology DSM 5TR Overview and the Anxiety Disorders Mnemonics Memorable Psychiatry Lecture by Psychiatry Numerology, published by YouTube in 2021. What key factors define anxiety disorders? Fear and worry of that is excessive and persistent, of possibilities of bad things to happen. It's exhibited through physiologically, psychologically, and behaviorally. The physical symptoms may be increased heart rate, shortness of breath, sweat, trembling, and behavioral would be panic attacks and restlessness, trying to stay away from people and places that cause them fear and anxiety. Cognitive symptoms, thoughts of the worst to come, difficulty with concentration, control, and worries. And anxiety can be a motivation for most people. Say if they're doing diet and exercise, they'll have a plan and be able to stick to that. But some people have an intense and overbearing anxiety about things like that. It'll be a constant thought, constant fear and worry about how they're going to get it done instead of actually doing it a lot of times. And there's a state and trait explanation of acute chronic anxiety, and they use the form of sweat. Students fear C's for sweat, tremble, unsteady, dizzy, tingling, shortness of breath, fear of dying or going crazy, chest pain, chills, and choking. So that's symbolism of students fear C's. To understand that there's a chronic miserable, which is muscle tension, irritability, sleep difficulty, low energy, restlessness, or poor attention. They have deep thoughts and basically have body pains or complaints of body pains. From a diagnostic perspective, what is the difference between general anxiety and social anxiety disorders? General anxiety is focused on all sorts of issues that could happen, basically in health, relationships, work life, or everyday stressors. Social anxiety focuses on the extreme fear of being judged, embarrassed, rejected, or possibly even humiliated. And an example would be their public speaking or meeting new people, and those situations are very stressful for them. General anxiety people, their example would be if they took a job and they just kept having fear of this job. Did they take the right job? Over and over, obsessive thoughts of that, not being able to sleep, usually because of that. And then the impact for general anxiety affects daily life. It actually affects both their daily lives, overall function, relationships, and it also affects in social anxiety, affects their social life and usually a lot more of their career life. Why is it important to have specifiers and modifiers present in listing any of these diagnoses? Well, for example, for generalized anxiety and more of an accurate treatment plan, different displays of the same disorders basically guide and tailor the specific needs like anxiety and distress and panic attacks or only fear performance. So it'll be more specific in understanding their needs. Improved accuracy will refine the diagnostic process of understanding each disorder and tailoring the treatment plans from what the information the specifiers provided and what is needed for that best treatment plan. Improving and understanding the client experience is such an important thing because it'll better help them to diagnose. With the specifiers and modifiers, it's understanding the level or severity of, per se, like if they're having a panic attacks, so they can provide better treatment plan and better, um, like if they need some medicine and to do CBT therapy as well, because most anxiety requires that you do both. You do some medicine and you do some talk therapy to get through it and to get through the thought process of the fears. Also, it basically helps them to tailor to the unique needs of the people that have these issues, and also helps with research and data collection to classify and categorize these disorders. Specifiers and modifiers are more reliable, more basically creating more reliable data and research. And they help beyond broad categories and focus on specific variations or levels of each individual's experiences. Thank you.